Hello, my name is Mira Shbeir, a student at the Faculty of Dentistry at Al Azhar University. In this video, me and my colleagues will present a scientific study that examines the relationship between demographic factors and dental health among children and adolescents in Sweden. Okay, this slide provides general background information about the study. It includes the study title, the research who conducted it, the country where it was carried out, and the journal in which it was published. It also shows that the article was obtained from reputable academic databases. This study included a very large number of children and adolescents, which make the results reliable. The DMFT system was used to measure dental caries, and the research compared dental health between children living in urban and rural area. I will now hand over to Shahid, who will continue the presentation by explaining the introduction of this study.
After Mira gave an overview of the importance of dental caries research, I will now present the study's introduction and methodology, highlighting the role of the DMFT index in assessing oral health among children and residents. The study shows that oral health in Sweden has improved significantly over the past years, mainly due to free dental care up to age 19 in both public and private clinics, as well as school-based preventive programs. Despite this improvement, dental caries remain a concern for some groups, especially children from low socioeconomic backgrounds, or those who develop caries at an early age. As early caries increases the likelihood of future lesions. The study also examined the impact of demographic factors on caries prevalence, including age, gender, and place of residence. Age is a significant factor, while previous studies reported conflicting results regarding gender and residence, which motivated this study. The main aim of this research was to analyze the prevalence of dental caries using the DMFT index and study its relationship with age, gender, and place of residence. Regarding methodology, the study included approximately 301,000 participants aged 3 to 19, covering more than 97% of the target population. Data were collected from public and private dental clinics through routine clinical examinations, supplemented by X-rays when needed, and recorded electronically based on risk-based follow-up intervals. Having explained the introduction and methodology, I now hand over to Shaima, who will present the key results and discuss their practical implications for children oral health.
Following Shahid's explanation of the introduction and methodology, I will now present the results, focusing on age and dental caries, as well as gender differences. The results showed a clear relationship between age and dental caries. Younger children had very good dental health, especially those aged 7 to 9 years, where almost 90% were free from cavities and fillings. However, as age increased, the prevalence of caries also increased steadily. Adolescents showed the highest levels of caries, and by the age of 18 to 19, only about one-third were caries-free. This indicates that adolescence is a critical period of the development of dental caries and highlights the need for stronger preventive care during these years. The study found that gender differences in dental caries vary depends on age. Among younger children, especially those aged 7 to 12 years, girls had a high risk of caries compared to boys. This may be related to earlier tooth eruption in girls, which exposes their teeth to caries risk for a long time. In contrast, among older adolescents aged 16 to 19 years, girls had a lower risk of caries than boys. This difference may be explained by better oral health behaviors, and hygiene habit among adolescent girls. These findings show that the effect of gender on dental caries is not constant and it changes across different age groups. I will now hand over to Yara, who will explain the results on residents and discuss the main points of the study.
After Shaimai presented the results related to age and gender, I will now discuss how place of resistance affects dental caries and highlight the key points from the discussion. The results show that children living in urban areas have a higher risk of dental caries, while children living in rural areas have better dental health. The biggest difference was seen in children aged 7 to 9 years, which is an important age because permanent teeth start to erupt. Overall, these findings highlight the importance of preventive care and good oral hygiene, especially for children living in urban areas. In this study, switched children and adolescents generally had good dental health. The large number of participants make the results strong and reliable. The study showed that the children in cities had more caries, which could be linked to diet and lifestyle. There were also differences between boys and girls, possibly due to social habits or biological factors. It's important to note that only advanced caries were recorded, so early cavities were not included. Overall, the findings help us understand which groups may need more attention and support in preventive dental care. In summary, these results highlight that dental caries is influenced not only by age and gender, but also by where children live. Now, Rihan will continue the presentation by explaining the conclusion and the implications of the study.
Following Yara explanation, summary of results and implication, I will now implication for preventive dental care. Overall dental health among Swedish children is good, but certain groups still need more attention. خصوصا المراهقين والأطفال وهم لازم يكونوا التركيز الأساسي في برامج الوقاية. Adolescents and children living in urban areas should be the main focus of preventive dental programs. These findings are useful for public health planning and dental practice. They help identify high-risk groups and support the development of targeted prevention strategies for children, parents, and healthcare providers. By highlighting vulnerable population, especially those in urban areas, this result guide effort to improve oral health awarenesses. They emphasize the importance of collaboration between schools, families, and healthcare professionals to ensure effective delivery of preventive messages and achieve measurable improvement in dental health among children and adolescents. Overall, Swedish children have generally good dental health، لكن بعض الفئات بتحتاج اهتمام أكثر. التركيز على الوقاية helps improve oral health. Thank you, Dr. Walid Al-Hout.